From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reported tonight, Amarachi Ubani.
Good evening and welcome tonight. Health Minister gives assurances that Nigeria is making good progress with containing the Ebola virus disease, confirms the 19th case in the country. Lawmakers in Edo State resume hold separate sittings in Benin City after months of protracted crisis. The military says that the flashpoint town of Bama in Borno State has been recaptured. And EU member states approve new sanctions package against Russia to come into effect in the next few days.
And on business news tonight, National Bureau of Statistics releases second quarter economic report. Says Nigeria's economy grew by 6.54%, boosted largely by the services sector.
And on sports news tonight, Japan's Kei Nishikori and 14th seed Marin Cilic slug it out in the US Open men's singles final.
Begin tonight with a confirmation by the Health Minister of the 19th case of Ebola virus disease. Professor W.H.O, during his weekly briefing in Abuja today, said the 19th case is the fiancé of one of the primary contacts with Mr. Patrick Sawyer, who died of the disease. The minister further revealed that the total number of deaths from Ebola in the country stands at 7.
The total number of confirmed cases of Ebola virus disease in Nigeria is 19. 15 in Lagos, 4 in Port Harcourt. The 19 cases, which have been actually in existence but not confirmed earlier, is the first of one of the primary contacts of Mr. Sawyers, who died of the disease. The test results were equivocal, but further tests have now established that indeed he suffered from the disease. He had only mild symptoms and he has since recovered from the illness. He was quarantined, but because of the initial equivocal test result, he was not placed on active treatment. The total number of deaths from Ebola virus disease in Nigeria stands at 7. 5 of these died in Lagos. One, as you know, in this case, Mr. Patrick Sawyer in a private hospital, while the other 4 died in the isolation ward in Lagos State. 2 of the 7 died in Port Harcourt. The total number of patients who have been successfully managed and discharged stands at 9. But if you want to talk of total number of survivors, it is 11. But those who had active treatment, treated and discharged, 9. The latest is the sister of the Port Harcourt doctor who was discharged from the isolation ward in Rivers State yesterday. At the moment, only one person, the wife of the Port Harcourt doctor, is on treatment in the isolation ward in Lagos State. She no longer has any symptoms and is undergoing a series of tests preparatory to her discharge from the isolation ward this week.
The Minister of Health, Professor W.H.O, on the latest cases of the Ebola virus disease in Nigeria. Now, there may be no case active one of the disease at the moment, but health personnel and government officials are handling the situation in the country with cautious optimism. The Rivers State Health Commissioner reveals that in a matter of weeks, it will be clear if the nation would still need to contend with the scourge. Our correspondent, Mary Alala Yusuf, reports on the situation in Rivers and other states.
Regions of Rivers State may be rejoicing over the news of the discharge from the isolation center of the sister of Dr. Enemoa, who died of the Ebola disease, but there are uncertainties over the latest entrant.
Yesterday,
the State Health Commissioner says a child has been admitted, but it has not yet been determined if it has the deadly disease.
An infant of 18 months was just admitted and it's not yet tested. So when we test, I will let you know what's going on. If we are not flooded this week, next week, then we will be coasting home.
Health authorities at the University College Hospital, Ibadan, in Oyo State, deny that a patient who died there was suffering from EVD. The Chief Medical Director of the institution, Professor Pt.1 Alonge, explains that tests confirm he died of Lassa fever.
Even though I've contacted the Honorable Minister of Health, contacted for about 12 midnight, to let him know that there is no Ebola in Ibadan, but we'll have a case of Lassa, and his instructions are quite clear, which we already know. That's the later protocol. Make sure you contact the state epidemiologist, Dr. Abbas Bola, and also from him, he will contact his colleague in Lagos, and I will speak with the Commissioner for Health in Lagos. So between the Commissioner for Health in Lagos and the Lagos State epidemiologist, they will do the contact tracing. They will be responsible.
Delta State is also dispelling rumors that there's an outbreak of the disease there. The State Commissioner for Information clarifies that a few characteristics of EVD in some cases cause unnecessary panic among residents. All seems set for these men and women in Nasarawa State to embark on their journey for this year's Hajj operation. But anxiety has been high among the Muslim pilgrims with the outbreak of the Ebola virus disease in Nigeria and other West African countries. The governor of the state, Tanko Al-Makura, as well as members of the Muslim Pilgrims Board are here to allay those fears and spell out the acceptable code of conduct for the faithful.
Pilgrims may be subjected to antics of stigmatization by other nationals. I urge you to exercise restraint in the face of any unfriendliness in this regard. I also urge you to be very vigilant when mingling with other nationals, especially those from the West African sub-region. You should adhere to some of these hygienic rules so that you don't get contacted with the disease while you go for your devotion.
The U.S. President Barack Obama says his country must do more to help contain EVD in West Africa for the sufferers as well as the protection of foreign aid workers.
The problem that we've got is in right now a limited portion of Western Africa. So what I've said, and I said this 2 months ago to our national security team, is we have to make this a national security priority. If we do that, then it's still going to be months before this problem is controllable in Africa, but it shouldn't reach our shores. Now,
he adds that if America does not make that deliberate effort now, there's a possibility that the virus could mutate and eventually spread to other countries, including America.
Medical experts say things seem to be looking up for Nigeria with no confirmed cases at the moment, but fingers remain crossed as the nation awaits the expiration of incubation days without a fresh case, which would signify that the country is really free of EVD. Mary Alala Yusuf, Channels Television News.
Reckitt's Bankers, makers of Dettol antiseptic products, is partnering with the Federal Ministry of Health to stop the spread of the Ebola virus disease through personal hygiene. The company's marketing director, Mr. Oguzan Silivili, explained that the collaboration is driven by its mission and vision to create healthier and happier lives. He says while Dettol has been in the vanguard of encouraging personal hygiene, the outbreak of the Ebola virus disease has increased the stakes.
Outside of the fingers, outside of the fingers, outside of the palm, inside of the palm, kendine yaz.
A demonstration of proper hand-washing technique by the marketing manager of Rekit Benkisa for Central Africa to kickstart the anti-Ebola campaign with the Federal Ministry of Health. The company says even though it has been in the forefront of promoting personal hygiene, the Ebola outbreak has made it more important to further sensitize Nigerians on good personal care.
Our efforts are purely a continuation of the public interest campaigns towards hygiene awareness by ways of frequent washing hands with good antiseptic soaps, sanitizing floors, other services with good antiseptic liquids. Our aim is to help create a habit of preventive hygiene to make Nigeria a truly germ-free nation. This indeed is the T.O brand, indeed in championing and campaigning targeted is saving 10 million lives.
The company says it is lending a helping hand to the government because of its belief that preventive care is the #1 way to stop the spread of the virus in the country.
We sincerely believe that only a scaled public awareness about containing Ebola virus disease, along with practicing good overall personal hygiene, can help contain this national and international challenge.
The federal government, on its part, showed appreciation for the gesture, urging other corporate bodies to contribute their quota to the management of the disease in the country.
You'll be seeing promos, campaigns in newspapers, TV, social media, radio, and other communication outlets. Some of them may involve officials of the Federal Ministry of Health, including the minister. Some may not, some may involve other Nigerians. But what is important is that Nigerians will get the right messages. They are spending money to do that. And we actually appreciate what they are doing in terms of using money to, their own money to help with public education.
The Ebola virus disease outbreak has led to an increased awareness for better personal hygiene. The Dettol campaign lays credence to the popular saying that prevention is better than cure. Amaka Okafor, Channels Television News.
In part 2 after the break, W.H.O youths protest workers' casualization by oil firms. That's in a moment. Please stay with us.